Taiwan has a national health insurance program, and citizens can also buy personal medical insurance to help them when they face illnesses. Cambodia, however, doesn't have such options. To get a better understanding of this issue, public hospitals require a registration fee of about $2.75 together with clinic fees of $5. Private hospitals may charge $6 for registration and $30 for the medical visit, while public hospitals may charge less. The medical care the Cambodians receive is very inadequate.
Getting sick or emergency medical treatment may not be an option for many in Cambodia. Royal Phnom Penh Hospital is Cambodia's premier medical facility. It treats an average of 250 patients daily.
Today I feel sore throat. Sore throat? Yes, and some headache.
Yeah, so how many days?
Oh, maybe around 3 days.
So had a fever also?
No.
In addition to the various departments staffed with specialists, the hospital also has advanced equipment, including a hemodialysis center, intensive care, and other special units. But the number of daily hospital visits is less than what a single department in a hospital in Taiwan sees each day, leading many to wonder what the problem is.
会来这里看诊的人就是
Most of the people who come here are local citizens, and many of them are quite economically well off because diagnosis and treatment here is quite expensive.
有点贵。
In general, the medical situation includes registration fees, clinic fees, tests and exams, and medicine means that the average trip to the doctor could cost between $50 to $100, and staying in the hospital for severe illness can cost between $300 to $1,000. Delivery at the hospital, whether it is natural or cesarean, is even more expensive. According to official 2017 data regarding basic wages, clothing and footwear workers' monthly salary is just $153. This means that the Cambodian folk saying of illness causes bankruptcy is quite accurate. While there are many advanced hospitals in Cambodia, much of the general public are actually quite sick with no access to treatment. Phnom Penh's Sihanouk Avenue has one area which is crowded all the time, which is referred to as a pharmacy street. Business is so good that there is even someone taking care of traffic outside, as these pharmacies are even busier than banks. Some doctors have privately revealed that many Cambodians buy their own drugs when they get sick, often leading to multiple drug resistances.
Generally speaking, when they have a small illness, they go to the pharmacy to buy drugs and take them for 3 or 4 or 5 days. If it has no use, they'll come to us typically when the illness is much more serious.
Roger Zhang is 42 years old and the director of the Formosa Clinic. He is proud of lifting the quality of medical care in Cambodia for the past 10 years.
This is our internal medicine clinic. We also offer ENT treatment as well as ultrasound. This side is our emergency surgical department with some drugs for emergency treatment, along with emergency equipment here providing full treatment services. We basically offer all clinic services. I'm trained in emergency care and have done internal and OB/GYN care. The only thing I haven't done is deliver a child.
Relying on his emergency room skills, Roger Zhang brought nursing students from Hong Kong University to Phnom Penh for a special experience. This Taiwanese-style diagnosis means registration costs just $20. Over the past 4 years, a lot of locals and Taiwanese businessmen have become loyal customers.
They are from Taiwan, so it's quite an intimate feeling like our hometown. It gives us a great feeling of security.
This small hospital has high aspirations. In addition to servicing compatriots, it also takes into account the economic conditions of Cambodian people, sometimes charging them half of their normal fees, taking only $10. It also seeks to provide Cambodian physicians with job opportunities and relevant clinical experience.
We just want to help with medical care in remote areas, helping them enhance their medical quality. We hope our countrymen can go overseas and provide medical care which could provide more opportunities in the future. There's still a lot of room for development here, and we hope that Taiwan can invest more resources here.
Members of the royal family used to go to Thailand, Vietnam, China, and Singapore for treatment, showing little trust in the medical environment in Cambodia. Taiwan once again is working in a country which is not a diplomatic ally, showing its compassion and identity as a world citizen, helping them in the important area of medical care.